Hi, I'm Dr. Nichelle Haynes,
I'm Dr. Kristen Laster.
and we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
This has been requested a few times.
I get asked about this probably once a week by my patients.
Different specific questions. Like they'll have gone online and researched, different things and say like, oh, what about this thing? I'm like, I don't really know. We're going to talk about ketamine today. So I think talking about ketamine, you have to start a little bit with organic chemistry. So we'll start there. Hang with me. We're gonna get to the good stuff about ketamine, but this is important to know for some background. So IV ketamine is racemic ketamine, and that basically means that, imagine a hand like this, right? So it has a pinky, a ring, a middle, a pointer, and a thumb, right? So this is what ketamine is. But this also has a pinky, middle, a ring, a blah, blah, blah. So it's the exact same components and it looks the exact same.
In terms of chemical
I'm
compounds.
part of the chemical compounds, the same components. But this one is technically different than this one because if you were to try to attach it, it's not going to do the same thing. Does that make sense? Yeah. Okay. So racemic IV ketamine is both of the types. So both of the compounds. This one's spun this way and this one's spun this way. So IV ketamine is both, and the intranasal version of the ketamine is just one of them. So it's S. So S is one of the ways it's spun. And there's also R ketamine. So having that information helps you understand the two different versions. So the IV ketamine is both, and the intranasal version is just the S ketamine, and that is much more potent than the IV version. So in the IV version, you get a certain dose in your IV, and it's a much larger dose than the small, tiny dose that you get inside your nose if you're going to do the nasal spray. So it makes a little bit of a difference when we talk about that. And they're also doing some studies about this other version. So we have the S and we have the R. They're also doing some studies about the R ketamine, and it looks like it might be pretty promising as well. So interesting little tidbit.
And what is it helpful for?
The S-ketamine version was approved in 2019 by the FDA for treatment-resistant depression. And there's not technically a definition that says these people qualify and these people don't. But as psychiatrists, we would say people who are treatment-resistant with their depression have tried several different medications, have been in quality therapy, have tried lifestyle changes, and even with all of those things together, they're not getting to a place where their depression is adequately treated. So we would call that treatment-resistant depression. But that's one of the things about the studies with ketamine that's sort of iffy, is that different studies will use different definitions of what is treatment-resistant depression. So we use ketamine for treatment-resistant depression, and we have data about the IV version and the intranasal version. And essentially they have similar side effect profiles, although since you know that the intranasal version, the S-ketamine, is more potent, it has fewer side effects.
Why is that?
Because you need less medicine to get the same result, and it's more specific for that receptor. So one of the other things about ketamine is we don't really know exactly how it works. There's lots of different theories. It may work on the ions that go in and out of cells. It may work at the NMDA receptor, which is N-methyl D-aspartate receptor. It may work on second messengers, so like something comes in and then it tells the cell to do something and it works there. We don't really know.
There's
exactly
lots of different
how it works.
proposed mechanisms of
Yeah.
action.
Yeah. And it may even work on the gut microbiome. I mean, we have some ideas. And
Maybe it does all of the
Maybe it does all of it. We don't really know. I think that's one of the issues, is that we don't have psychiatry funding for all of those things. So with the IV administration of ketamine, the racemic version, at antidepressant doses, the most common side effects are things like depersonalization, feeling like you're out of your body or not really who you are, or maybe even derealization, like things don't feel real. So ketamine, how am I going to say this? Ketamine is a dissociative anesthetic. So dissociation can include depersonalization and derealization. So we know that those are known side effects of the medication and may be part of the reason that it works. So depersonalization, derealization, you might have perceptual disturbances like things look funny or feel funny or sound funny. Hallucinations. You may have memory impairment, either short or long term. Urinary issues can be an issue with the IV version of ketamine.
What does that mean, urinary issues?
So ulcerative cystitis, so it would include things like blood in your urine, pain, urgency, or like feeling like you really need to go. So
it kind of feels like a UTI, except there's no infection there.
There's not a bacterial component. Yeah. Heart race, your heart could race, your blood pressure can go up, your breathing drive can go down. It's not a medicine you want to just be like playing around with, right? It could be very serious. Of course, antidepressant doses are lower than the doses that they use during procedures or surgeries or things like that, but you still can have significant side effects from it. Of course, it can be used recreationally, which is a problem. You don't want to be messing around with it. So people will use the dissociative side effect or the way it works to feel something different. So they'll get in like a K-hole where they can't talk or they don't feel real or, things just
I think it's important to point out that the studies, the research on ketamine being helpful for depression and PTSD and all that stuff were done with people who are also receiving therapy. So I think a lot of people are like, oh, well, just like use it recreationally and it will help me be less depressed. That's not how it was done in these research studies and probably is not effective in that way.
Yeah, this is not something to just like sort of play around with because it can be deadly.
It can be deadly, and in terms of the research, we don't have research on long-term side effects. So what happens when somebody's using this medication long-term? What does it do to their brain? Does it increase their risk of then having depression later on or cognitive disorders? Is it neurotoxic? Is it neuroprotective? We just don't know.
We do have that data for long-term recreational use, and it is definitely not great for the brain. Cognitive difficulties, memory impairment, you can kind of get stuck in that dissociative state or kind of go in and out, delusional thinking, and worsening of mood. And we know at recreational doses for a long period of time that it is neurotoxic, meaning that it's harmful to your neurons overall. So lots of information, but what does it mean? Is it actually helpful for depression? It's really hard to know. It is helpful for treatment-resistant depression in studies. But what does that mean in real life? Because life is not as cut and dry as studies, right? So there are definitely barriers to getting the medication, which we can talk about later on. It's expensive. You don't have the data long-term about what it does at antidepressant doses. That data may not really translate to real life in a way that's actually more beneficial than the treatments we currently have. In fact, I saw a study where they were comparing ketamine used for treatment-resistant depression versus lithium, which we sometimes use for treatment-resistant depression, and they couldn't say one would be much better than the other.
Yeah, and I think the important piece to recognize is it's experimental still, right? So we just don't have the information. And so if somebody does have treatment-resistant depression, we want to try the things first that we have more information about, the treatments that we know the long-term safety side effects of, or we know how it's working a little bit better than we do with ketamine. So one of the mainstay treatments of treatment-resistant depression is ECT, or electroconvulsive therapy, which back in the day was done in a very different way than it's done nowadays. Just like surgery back in the day was done, in barbaric ways, and now we have much more humane ways of doing surgery, similar with ECT. And they have done studies comparing ketamine versus ECT for treatment-resistant depression, and ECT continues to be better and more effective than ketamine.
I think overall with ketamine, the research is exciting because it's one of the handful of things that we've had in the last few years that have come out that's novel. And I really do think that having more data, doing more research, really honing in on who is this population that can benefit from it, how much do we use, when do we use it, how often, what are the long-term effects, we will be able to utilize it more efficiently and effectively. But for now, that data, we just don't have it. So we're going to focus on the things that we do have the data for and wait for that new data to come in to support its use effectively and in the right populations and those kinds of things. So it's promising, it's exciting. Of course, a lot of people have used it, and hopefully that information comes to us. But I think the other side of it that's really important to think about is if your clinician is saying like, oh, we should turn to ketamine, what other things are at play there?
Yeah, so one of the big things with ketamine is it's a business. So there are a lot of people in the industry for ketamine who are making a lot of money off of it. And so it might be in their best interest or their incentive to say, hey, you should try ketamine next, rather than maybe some of the more evidence-based treatment options that there are. So it's important to look at who is the one recommending it. Are they qualified to recommend it? Is there somebody more qualified who you should get a second opinion from first? All of that stuff. So ketamine is a drug that is not FDA approved for
anything other than treatment-resistant depression, and that is the intranasal version.
Yeah, so IV ketamine is not FDA approved for any mental health disorders yet. And what that means is that insurances are not going to pay for something that has not gone through these rigorous studies that require FDA approval. For that reason, ketamine, when it's given IV, is usually cash pay basis, meaning that you are paying out of pocket with your own money for this treatment. And because of that, it's also not regulated. So there's not like this FDA regulation. They can't come in and say, hey, you need to be doing these certain things. And so these clinics are also not regulated to the same standards that maybe a clinic that is doing some other sort of FDA regulated treatment would be. Mm-hmm. So it's a huge industry in that there is a lot of money invested into ketamine clinics. It's estimated that there's around like 500 to 750 clinics throughout the United States, and private equity investors and other business people have invested a lot of money into ketamine because it's expected to boom. It's expected to make, I think, $3 billion over the next like 5 years or something.
I would guess it's probably even more than that.
And it's valued at over $3 billion. So it's something that is going to make a lot of people a lot of money. And that, on top of it not being regulated, is just like red flags for be really careful in terms of who's giving you the medication, who's recommending it, doing your due diligence of research and education before diving into it. Mm-hmm. Another really interesting thing about ketamine that we don't see with a lot of other mental health treatments is that it doesn't have to be prescribed by a mental health provider. In fact, the vast majority of people who prescribe this medication have no mental health treatment. A lot of these prescribers are people who maybe have a background in anesthesia or a background in family medicine or emergency medicine, and they don't have all the training and education that goes into diagnosing and treating mental health disorders, meaning that they might not know what is the true diagnosis going on here, and what are all the different treatment options that are here for this person, and is ketamine the safest? So again, really making sure that you're looking into who is the one prescribing it, and should you get a second opinion first before trying out that drug.
Right. I will say that the vast majority of psychiatric medications are not prescribed by psychiatrists. Even if you're looking at the SSRI class of medication or any of the traditional medications that we have in psychiatry, the vast majority of them are not prescribed by psychiatrists. That's just because there's not that many of us, and there's a lot of people who need psychiatric help. But there is a lot of evidence to support how to prescribe those medications.
They're regulated.
They're regulated.
What doses to give, how often to give them.
Mm-hmm. Right. And so there's a lot more safety measures kind of put in place to be able to do that correctly, do that in good faith. So I think the lack of regulation, the lack of psychiatric training, the
big profitability,
and I just imagine being in a place where I've been depressed for a really long time. I feel very hopeless. I have tried the things, and if I were to qualify for treatment-resistant depression, and someone were to say like, hey, this could help you. Like, it's a really vulnerable population. And so like all of those things that come together make it really scary for those of us who are kind of on the other side of the ketamine industry. I wouldn't say we're on the other side, but just we're not involved in that industry, and it's just we see a lot of really big red flags. So it's not to say don't use ketamine. It's not to say it's not a viable option for you. We just want you to be really careful and have some curiosity around what are my other options, who is going to be monitoring me, how much are we using, what's the data around that, and really advocate for making sure that you're safe in that process if you are going to go down that road.
Yeah, so it's important to point out that there are a lot of ketamine clinics out there that are doing this for the right reasons. They are mental health providers, psychiatrists, and psychologists, people who are trained in diagnosing and treating mental health disorders, and they are using it in an appropriate way and trying other therapies and treatments when appropriate. So it's not to say that those don't exist. It's to say that there are so many different clinics popping up all over the United States that are not regulated and are not being run by anybody who has any kind of mental health background. And so to be careful, to make sure that you're looking into the clinic that you're going to and who's administering it, and just making sure you're going to a reputable place.
Right. Ooh, talk about that mail-in stuff.
Oh, yeah. So now with COVID, we have been able to prescribe controlled substances to people who we've never seen in person before, which was not the case before COVID. You would have had to see somebody in person, evaluate them, do a physical exam, and then say, okay, you can have this controlled substance. This doesn't exist anymore. So now people can do these online telehealth appointments where they never actually meet their provider, and maybe their provider is not even anyone who, again, is mental health trained, and they can say, okay, you're okay to take ketamine, and they will actually mail you ketamine.
But
just blows my mind.
We don't have data around oral ketamine being effective for treatment-resistant depression or really any mental health condition as far as I know. I mean, that might not be true, but I don't. And I did a deep dive on trying to find that stuff. And
yeah, so, and surprise, surprise, a lot of those companies are private equity owned or backed by a lot of big dollars. So they stand to make a big profit on what they're doing.
It's not to say that all treatment that you get online is bad. It's just, whoa.
Just be careful.
That's a big one. Yeah, so I think it's interesting, it's exciting, but we just advise a lot of caution. Talk to your clinician. and ask a lot of questions. If that is the route that you're interested in taking, ask a lot of questions and make sure that you are being safe.
Yeah. Especially if you're going to spend that much money.
Yeah. Or your brain, like.
Yeah. Take care of your brain.
Yeah. Okay. Ketamine, interesting one.
Mm-hmm.
Also to say, like, data around pregnancy.
No, we have none. Don't use it.
Big question mark. We do not know.
Or talk with a qualified psychiatrist before you use it in pregnancy.
Yeah. Or breastfeeding.
Or breastfeeding.
Yeah. Okay, I hope that was helpful. Let us know what you want to learn about, and we will try to make videos for you. Thank you so much for being here. Please like, comment, subscribe, share with your friends. We'll see you soon.